everyone. I am Sanjana, onco nutritionist from ZenOnco.io. Today we shall be speaking about dietary calcium intake and its importance for cancer patients. Calcium is an abundant mineral which is found in our body. Calcium makes much of the structure of the bones and the teeth, and it is also important for the various bodily movements which keep the tissues rigid, strong, and flexible as well. Now, which vitamin is important for the absorption of calcium? Vitamin D, which is also known as the sunshine vitamin, is important for the absorption of calcium in the gut and also is required to maintain adequate levels of calcium in the body as well. Did you know that 98% of the calcium in the body is stored in the bones? How fascinating is that, right? Alright. So, total calcium levels can be measured, okay, either by serum levels or the plasma levels when you get a blood test done. What are the normal levels of calcium? The normal levels of calcium are 8.8 to 10.2 milligram per dl. So now let us explore what are the rich sources of calcium. The rich sources of calcium are your A2 milk and your milk products. You have your spinach, broccoli, chickpeas, soya bean, sesame seeds, drumsticks, almonds, and also tofu as well. However, there are certain anti-nutritional factors which could hinder or reduce the absorption of calcium in the body. So, which are these anti-nutritional factors? Mainly phytates and oxalates are the anti-nutritional factors which are found in certain foods which could reduce the absorption of calcium in our body. Now let us try to understand what is the deficiency of calcium. So as per our recommended intake of calcium, now if we do not take enough of calcium rich food in the diet, down the line or gradually it can also lead to a calcium deficiency. So the calcium deficiency is known as osteoporosis. Osteoporosis is a condition wherein there is reduced bone strength. Some of the signs and common signs and symptoms to look out for if you're having or you suspect that you're having a calcium deficiency is back pain, or you might find a leg pain as well. So the bones will become weak, they will reduce their strength, and the porosity of the bones will also reduce. Hence, it is extremely important to incorporate calcium rich foods in the diet. Now, suppose in cancer patients, there are generally times when we are on various cancer treatments and we are also taking medications as well. Mostly in gastric related cancers or esophageal cancers. Sometimes, if the patient is going to be having a condition such as gastroesophageal reflux disease, okay, the doctor might put them on proton pump inhibitors or antacids. All right. Now, it is shown that long-term usage of proton pump inhibitors or antacids can also cause calcium deficiency in the body. It is very important to sit down with your doctor and understand what dietary supplements need to be taken if you are taking long term proton pump inhibitors because of certain gastric conditions as well. So the doctor will be taking a blood test and they will also be doing other examinations as well, which will help them to understand if you are really in need of calcium supplementation. And based on your requirement, a calcium dietary supplement or calcium rich foods will also be advised to you. All right. Now let us see the role of calcium and its effect on cancer. So there are a lot of studies which are being performed, and there are a lot of various research studies which are being carried out to understand the actual role of dietary calcium, and is it beneficial or what is its efficacy for the cancer patients as well. So generally what happens is sometimes the cancer patients who are undergoing cancer treatment, now because they undergo malnutrition, also sometimes they are severely undernourished because their nutritional status is altered due to poor dietary intake, and sometimes what happens is albumin levels also tend to fall. So albumin, as we had discussed in the earlier videos, is a marker to understand if there is reduced protein intake in the body or if the patient is at a risk of malnutrition or not. So if the albumin levels are reduced in the body, sometimes even the calcium levels tend to go down. So this is so the total calcium in the body could go down. So it is very important first to correct the albumin levels in the body, and then it is again important to correct the calcium levels in your body as well. Okay, so now they have been doing various studies in the field of in the area of dietary intake of calcium to understand its role in colorectal cancer. So one study was done to understand how calcium is going to play an important role in colorectal cancer patients, and it has been seen that dietary intake of calcium is shown to play an important role in reducing the risk of colorectal cancer as well. Another study was done to understand that if chemotherapy induced peripheral neuropathy occurs in cancer patients, what is the role of dietary calcium? Is it beneficial or is it not beneficial? Okay, so from the study, it was concluded that dietary intake of calcium does have an important role to play in reducing the severity of chemotherapy induced peripheral neuropathy in cancer patients as well. Now, here are a few tips, easy tips, which I am going to be sharing with you today on how you can incorporate calcium rich foods in your diet. So, you could include 1 cup of low fat A2 curd in your major meals at least once in a day. Also, it has been seen that low fat milk or skim milk contains the same amount of calcium as whole milk as well. Try and including the green leafy vegetables which are important in calcium in your major meals on a daily basis as well. And you can also include sesame seeds or almonds in your diet as well. You can make a sesame seeds chutney or have overnight soaked almonds in the morning as well. So to conclude, yes, calcium is an abundant mineral which is required by our body. As discussed in today's videos, you can surely try out the easy tips to incorporate calcium in our daily diet as well. Thank you so much for watching my video. We at ZenOnco.io are always here by your side to navigate you through your cancer care journey. In case of assistance, you can reach out to our cancer coaches on the below mentioned contact number. Thank you.